Hey.
What's up, Nurse Anderson?
Hi, NCLEX High Yield family. Dr. Z, Nurse RN Anderson is in the house. And if you ain't here, what is you doing? Okay. I'm here to bring some energy to you guys and take over for 60 seconds. So, those of you guys who are wondering, maybe today is your first day logging on and you're saying to yourself, am I in the right place? You are in the right place. Those of you guys, maybe you struggled in school and you figured, how can I get all of this in my head? Dr. Z has a way to teach I have never experienced before. Those of
Wow.
you guys who are on here right now, older age, 40s, 50s, 60s, and maybe you learn differently, you are in the right place. You are here for a reason, guys. We pumping it up, okay?
I love it. This is hype. I love the vibe. I
Yes.
love it.
Nurse Anderson is, oh, I see you guys shouting me out. Hi, the energy is here. You found the one to speak for Dr. Z. We are in the building.
I love, this is why I built this community. Is because of people like Nurse Rachna, Nurse Anderson here in front of us, because it really is like we're like a tight-knit family here.
Oh, yes.
I mean, like we got each other's backs no matter what. And
Oh,
I
yes.
love it. I love the vibe. Nurse Anderson.
I am
So
so
what
happy.
of ours did you use?
Okay, so guys, I logged on for the live course and I logged on for the live course from day one. I was in the August September class and I tested last month December. And I want you guys to know this is literally my first time trying. I see somebody ask in the chat, can anybody pass on the first time in this class? I am an example. I am not a nurse wizard. I am not a science wizard. I literally followed Dr. Z's teaching, his method, and stuck to the plan day by day. So first time test takers, guys who's logging on today for the first time, you can do this first time. And I want
Let's
you guys to
go.
know I didn't use anything else. Dr. Z was the only study material that I used other than maybe some YouTube. You want a little bit of clarity, but this was the only thing I used. No other textbook was used. First time test takers. But before I go, guys, I want to give a special shout out on here to my family and friends here and the repeat test takers, because believe it or not, even though I went one time, when I would listen to you guys' stories, sometimes you guys get discouraged and say, I took this test 2 times. I took this test 4 times, 6 times. Your story encouraged me and pushed me and gave me the drive even more. Guys, do not give up. If you're saying to yourself, I'm logging on here, I feel lost. I took this test 3 times, 4 times, and you want to know, should I do the live course? I sat down in his class every course. And when you have the live course, you have on demand available. You can get private tutoring one-on-one. They gave me a recommendation when I finished this course with my name in the recommendation. Okay. It is personalized for you and my benefit. The only experience I can tell you is I did the live course and it worked for me. First trial. RN
Let's go.
Anderson in the
How
house.
let's go. How many questions were you?
Guys, I had 145 questions.
There you go.
And let me tell you, the only thing that made my anxiety, because if you guys remember, I posted in here before, and I said my name is Anxiety Anderson, and believe me, you hear Dr. Z's voice in your head saying, "Don't worry about everyone else who says, oh, I only got 75 questions and I was out." If you see that question going up to 76, 89, 90, 104, make sure you take your breaks on that NCLEX. I took a break at question 40 and a break at question 100. And I went in the hallway and started jogging and drinking more water and get your mind going. Forget about the questions. Those questions keep going. The computer is trying to say, let's give this nurse a chance. She's
Yeah.
on that path. We want to give you, because that Richter scale is going up and down. Don't get nervous about why am I going to 90? Why am I going to 110? It's another chance for you to pass your test. For those of you who haven't tested before, don't worry about it. But again, shout out to you guys who are on here who failed before and you don't have the wherewithal and the drive and you want to give up. Shout out to those who don't have the support in your household, from your husband, from your family. They're pushing you. Maybe you're the first one who had a degree. Maybe you don't have help. For me personally, I quit my job And I
Wow.
said, when I pass this test, I am going to come back on NCLEX High Yield and give the encouragement to someone that's saying to themselves, I don't know where to go. I don't know how to do this. I quit my job. There was no other financial coming in, and I took a heavy financial hit with no finances coming in. And you know what my job was? Listening to Dr. Z and go to the library every single day. Because when you quit at the end, the bills are still coming in. In the end, you have to sacrifice this small sacrifice time.
It
Okay, you
is.
guys can do this. You guys can do this. I know everyone has their own story. Some of you have 3 jobs. Some of you have 3 kids. Some of you don't have support from family. Dr. Z is the place to be. And now I'm happy to say I'm an RN.
Let's go. And I want to take Nurse Anderson.
Yeah,
You made the ultimate sacrifice. You quit your job, had
yes,
nothing coming in, but
zero.
how quickly are you gonna make money right now with the
It.
demand?
And guys, let me tell you something. As soon as you put up that resume with that license, I was an LPN before and went for my RN. Right now, nursing is the field to be. You will never be without. If you lose a job Monday, you're going to get another job Tuesday. You guys are on the right field. They are picking us out of the testing room to get you a job. So I
Yes,
get it. Everyone's story is not the same. Everyone financial cannot work the same. That's fine. But that was the sacrifice that I was willing to take, knowing that I have to put in that drive and that work and everything. You have to cut out the outside world, guys. That's the best advice I can give you. For a short time period of time, Dr. Z is your best friend. Nurse Crystal, I have many meetings with Nurse Crystal
she's
privately.
awesome.
This school, this is like a university. Dr. Z,
Yeah,
you are like a university. I have never
absolutely.
been taught the things that you teach in nursing school.
Yeah.
Never have I been able to pick up immediately and recite. You guys want to know how you can find extra time to listen to Dr. Z? In the shower, press play. You driving to work, press play. You cooking your oxtail, rice, and peas, curry chicken. There's us West Indian people in here. Press play. Dr. Z. The nurses are taking over. Yes.
Let's go. Nurse Anderson, thank you for one of the most motivational
Yes.
speeches
Jamaican
I've
flags
heard.
going up. Yes.
This is exactly. Thank you so much for sharing. Nurse Anderson, so proud of you.
Thanks, guys. We in
All
here.
right,
You guys can do it. Don't give up. We in here.
let's go.